What disease models reveal about the potential death toll in Ontario.
Anyone and everyone is at risk.
The sobering worst-case scenario and what we can all do to help save lives. The pushback after President Trump orders 3M to stop sending masks to Canada.
Having the necessary personal protective equipment is a matter of life and death.
I just can't stress how disappointed I am with President Trump.
More money, new details on the Canada Emergency Response Benefit, and making room. From hotels to convention centres, the conversion's underway to house patients and frontline workers.
Global National with Donna Friesen.
Good evening and thanks for joining us. Ontario Premier Doug Ford warned it would be a wake-up call, and today the province's public health experts laid out in stark terms what their disease models project. These are projections, not certainties, and there are best and worst case scenarios. Here's the worst.
Over the full course of this pandemic, which may last for 18 months or even 2 years, because we may have a smaller secondary or tertiary wave. Had we done nothing, Ontario may have suffered 100,000 deaths.
100,000 deaths in a pandemic that could last 18 months to 2 years. That's if no measures were put in place to slow the spread. Of course, there are measures in place. The economy has been virtually shut down and everyone's been told to stay home and stay physically distant. If that continues and if we all obey the public health measures, the Ontario death toll is still projected to range between 3,000 to 15,000.
I appreciate that to many people, these will be shocking figures. Where we end up depends on all of us. If we follow the rules, if we do our best to socially distance, we can get within that range and we can strive to get as low as possible within that range.
The decisions we all make now will affect how many people die. Ontario's Premier was explicit. It is everyone's duty to slow down the spread of the virus, and more restrictions are coming. All industrial construction sites, except for critical projects like hospitals and transportation, will be shut down this weekend. Ford says when he saw the projections, he knew drastic action had to be taken.
Over 1,600 people could be dead by the end of April. That's 50 a day, or that's 2 people every hour.
Never in our lifetime have political leaders had to make life and death decisions like they are in this pandemic. Eric Sorensen breaks down the Ontario projections and what needs to happen to prove them wrong.
April will tell the tale in Ontario and almost certainly everywhere in the country. The worst case almost unthinkable, a best case still shocking. In this province, without interventions like physical distancing, it's projected 6,000 would have died by the end of April. With current interventions, the number of dead, now below 100, is still projected to be 1,600 in 4 weeks. Premier Doug Ford, grim but resolute.
The situation is extremely serious.
He says lives are at stake if Ontarians don't avoid unnecessary contact.
Is a life worth going to the beach? Is a life worth having a few cold ones with your buddies in the basement? The answer is no.
Like every province, it is touch and go whether Ontario hospitals will be able to accommodate the surge in patients who will need intensive care beds soon.
Here's the current situation in Ontario. Right now, there are just under 200 COVID-19 cases confirmed in ICU beds. The capacity in the province has another 400 beds available. In a best-case scenario, though, the capacity is not going to be enough. The number of cases this month is projected to rise above 1,000. However, there is also a plan for an additional 900 beds to increase that capacity to meet with enough beds for the people that will need ICU treatment. In a worst-case scenario, however, there will not be enough beds available, which is why in this province and across the country, the measures being taken are so important.
Ontario hospitals have permission to increase capacity quickly.
Some of them are using space in retirement homes, and some of them are actually creating field hospitals.
There is reason for optimism. Early projections looked even worse.
Very clearly, the pain we've gone through in the last 2 weeks has been largely successful. So we have dramatically changed the course of this epidemic here in Ontario, here in Canada.
And so more measures are coming, like curbside pickup for some businesses.
And if we work together, we can write the last chapter of our story.
The story will not end soon, but what happens in April could define the course of the disease for months to come. Eric Sorensen, Global News, Toronto.
So those are the projections. Here's where we're at right now. In Ontario, there has been another big spike in new cases. More than 460 people were confirmed positive today. The total number of confirmed cases in Ontario is now more than 3,000. And here's a snapshot of the country. Quebec also had a big spike in new cases today, and the numbers are going up right across the country. More than 12,000 people across Canada have now tested positive, and more than 180 people have died. We know those numbers are not the full picture because many cases are not confirmed, many people have not been tested. The most immediate challenge to our healthcare system right now is a lack of personal protective equipment for frontline workers. And the American president is making things harder. Donald Trump told 3M it must stop exporting to Canada any N95 masks made in the United States. 3M immediately pushed back. It said in a statement, ceasing all export of respirators produced in the United States would likely cause other countries to retaliate and do the same, as some have already done. If that were to occur, the net number of respirators being made available to the U.S. would actually decrease. 3M makes 1.1 billion masks a year worldwide, none in Canada. President Trump has invoked the Defense Production Act to produce more supplies there. He's facing growing criticism outside the U.S. for his approach. Mercedes Stevenson joins me now. Mercedes, the president is making some enemies in a few places right now.
Yeah, Donna, and Prime Minister Justin Trudeau pushed back against this today, saying that it would be a bad idea and a mistake for either country to start restricting essential medical goods or services. And while he didn't threaten retaliation, he seemed to hint at it, noting that Canadian nurses are key and cross the border into places like Detroit every day to take care of American COVID-19 patients. Chrystia Freeland, the Deputy Prime Minister, said that Canada will do whatever it needs to in its national interests. But it doesn't appear that Donald Trump is hearing those appeals from north of the border. He just spoke at the White House, and this is what he had to say.
Both the government of Canada and 3M are pushing back on this DPA not to export N95 respirators. 3M says...
I don't blame them. They can push back if they want. We're not happy with 3M. We're not happy. And the people that dealt with it directly are not at all happy with 3M.
Premier Doug Ford also not happy with this situation. This is what he said to reporters earlier this afternoon.
And I just can't stress how disappointed I am with President Trump for making this decision. I understand, he's thinking I got to take care of my own people, but we're connected, and but even in saying that, I'm not going to rely on President Trump.
Now, Donna, a senior Canadian official told me that the CEO of 3M spoke to the Minister of Procurement earlier today and assured her that no shipments have been canceled or diverted at this time. We'll have to see what happens now that President Donald Trump has spoken again.
Mercedes, there is such urgency for PPE. Any sign today that more is on the way?
No updates on the number at this time, Donna, but the premiers did talk with the Prime Minister last night and agreed that they need to share to make sure those who need it most get it. New Brunswick and Newfoundland and Labrador expected to potentially be the worst off. The government trying to come up with innovative ways to deliver that material when it arrives, signing essentially a deal with Amazon to make those deliveries. Donna?
Okay, Mercedes Stevenson in Ottawa, thanks. Healthcare workers in the U.S. are dying, and they are begging, too, for more protective equipment. There are now more than 250,000 confirmed cases of COVID-19 in the U.S. That's a quarter of all the reported cases in the world. More than 500 people died in New York State in just 24 hours. Ms. Jackson Prosco reports frontline workers are beyond desperate.
You can see all the rooms are filled. The calls for equipment and help are growing more desperate.
Last night before I went to bed, we had over 60 patients waiting for a hospital bed.
Outside one Manhattan hospital, nurses staged a protest.
3 nurses, all COVID positive, with care for 35 patients. Just 3 nurses. Let that sink in. How can each nurse get to each patient?
There are so many patients that a 2,500-bed field hospital meant for those suffering from other illnesses is being converted to a COVID-19 treatment center. New York City is now allowing crematoriums to operate 24 hours a day. The state is on the verge of running out of ventilators.
So I'm going to sign an executive order that says the state can take ventilators and PPE from institutions that don't need them now and redeploy them to other parts of the state.
This will go down in history as a profound failure of our national government.
Governors are pleading for help from Washington. They've been given just a fraction of the supplies requested. Many states have refused to issue stay-at-home orders. The White House still hasn't issued a national directive.
If you look at what's going on in this country, I just don't understand why we're not doing that.
All the while, the number of dead rises by hundreds every day.
This coronavirus is for real.
Detroit bus driver Jason Hargrove tried to sound the alarm about the risks he faced transporting the public. He died from the virus this week in a city that, like New York, has seen the number of deaths and illnesses surge at an alarming rate.
The Centers for Disease Control has now formalized its recommendation that Americans wear cloth masks over their faces when out in public, but not surgical-grade masks to preserve them for medical workers. At the same time, the White House now says that anyone coming into regular contact with the president or vice president will first have to be cleared with a rapid coronavirus test. Donna?
Jackson Prosco in Washington, thanks. Hundreds of Canadians from 2 Holland America cruise ships are now back in Canada. Canadian passengers boarded a plane in Fort Lauderdale, Florida this morning, bound for Toronto. A document obtained by Global News shows 243 passengers were expected to board that flight. They will be screened here in Canada and subject to mandatory 14-day self-isolation. The cruise ships, one of which had confirmed cases of COVID-19 on board, were granted permission to dock at Port Everglades yesterday. There's more terrible news about that nursing home in Bobcaygeon, Ontario. 4 more residents have died from COVID-19. That means 20 residents in the 65-bed home have now died, plus the spouse of one of the residents. There are outbreaks in at least 26 long-term care facilities and 8 retirement homes in Ontario. This pandemic has left hundreds of thousands of Canadians without jobs. We know many have applied for employment insurance benefits. And if you applied after March 15th, you could be in for a raise. Our chief political correspondent, David Akin, has been digging into this. David, how is this happening?
Well, Donna, 2.1 million Canadians have applied for employment insurance benefits just since March the 15th. And of course, the government wants to process those applications as quickly as it can.
So the solution is to roll everyone who became or will become an EI beneficiary after March 15th into the Canada Emergency Response Benefit Program. The CERB is a flat rate benefit of $500 a week. It doesn't matter how much you used to earn or how long you were working. The average EI benefit is $400 a week. So hundreds of thousands who just got their first or second EI check could see a raise to $500 a week, and that could come as soon as next week. Now, the move from EI to the CERB will be automatic. If you've already applied for EI since March 15th, no need to apply. Now, I keep mentioning that date, March 15th. Those who applied for or were receiving EI before March 15th, those people will stay in the EI program and will not get a raise.
Now, government officials are acknowledging that this seems to be a bit unfair, and there is a general commitment to try to deal with this later. But right now, the goal for the government is not elegant program design. The goal of the government is speed. It's to get the money out the door as quickly as possible, and they believe this is the way to do it. Now, a couple of other points about the CERB.
It is available not just for those who would qualify for EI, but for anyone who has lost work because of COVID-19, and that includes the self-employed, contract workers, and so on. You can apply for the CERB beginning April 6th through the Canada Revenue Agency.
Now, the CRA says it has built a system that will be able to take in and process 1 million applications per day by phone. And let's hope they're right, because the CRA also says they're expecting 3 million Canadians to apply on the day the gate opens. Donna?
Wow. And David, the Prime Minister also had news about the GST rebate. What did he say?
Well, the big news is the money's going to get out the door faster than anticipated. The Prime Minister had earlier said that he was going to double this year's annual GST rebate to $400 for a single person or $600 for a couple. And now we're learning that this one-time payment to 11.1 million Canadians is going to be direct deposited or mailed on April the 9th. Donna?
All right, David Akin in Ottawa, thank you. A glimmer of hope in Spain. Coming up, some optimism in a country where so many lives have been lost. Spain has recorded the first decline in the daily death toll from COVID-19 in over a week. 932 people died from the virus in 24 hours. It's still a staggering number, but it's down from 950 people the day before. The two back-to-back days still rank as some of the highest for the number of deaths. However, the daily rise is now slowing in Spain, and it's hoped the country may have reached the peak of its outbreak. The fired commander of a U.S. Navy aircraft carrier got a hero send-off as he left the ship. Captain Brett Crozier was relieved of his duties after raising the alarm about an outbreak of COVID-19 on his ship. His letter accusing his superiors of not protecting the sailors was leaked to the media. The Navy now says Crozier will be reassigned, not kicked out of the Navy. At least 137 sailors from the USS Theodore Roosevelt have tested positive for COVID-19. Still ahead, pop-up hospitals race to take the pressure off our healthcare system. A number of cities in Canada are scrambling to get field hospitals set up and running. Hospitals are often at capacity during the ordinary flu season. So with the expected surge of COVID-19 cases, getting more beds in place is a matter of life and death. Jeff Semple explains.
This Canadian charity responds to disasters around the world, from the earthquake in Haiti to the Ebola outbreak in Sierra Leone. But they're now looking to deploy their resources on home turf.
We've offered up our critical infrastructure tenting, these big tents that we use as field hospitals.
But so far, only a couple of hospitals have taken them up on the offer.
If we're going to need field hospitals, we're going to need them in the next 2 weeks. So it's not something that you can turn around on a dime.
These makeshift field hospitals, providing space for more beds and medical supplies, are slowly sprouting up in communities across the country. Vancouver's iconic convention centre is making room for around 270 beds, while Edmonton's Butterdome Sports Arena will soon be used to treat dozens of COVID-19 patients with milder symptoms. This hospital in Burlington, southwest of Toronto, is now a construction zone, working to nearly double its number of hospital beds. Experts say these projects are a great start, but we've got a long way to go. Canada has around 3,200 intensive care beds. That's about half as many as other developed countries, according to the OECD, despite spending more on healthcare.
COVID-19 aside, the flu season, many hospitals, and we're not different from that, have been running at 110 to 120% occupancy just with a regular flu.
So far, about 10% of Canada's cases have required hospitalization. And the outbreak in other countries has shown a direct link between the number of available ICU beds and patient deaths.
Once you run out of ICU capacity, your mortality rate does increase, certainly, because some of those patients you could have saved if they would have gone on a ventilator.
Ontario plans to provide 900 new ICU beds, just enough for the province's projected best-case scenario. Jeff Semple, Global News, Burlington, Ontario.
Checking in next, the hotels housing Canadians in need. This virus is killing business everywhere, and we know so many of you are hurting. That includes hotels. Many have shut down. Those that are still open are becoming a place of refuge for all kinds of people who have nowhere else to go. Ross Lord reports.
In the Montreal suburb of Laval, this is less a hotel than it is a field hospital.
All of the hotel staff is not there. They've been replaced with hospital staff. The hospital has essentially leased out the hotel and are operating that as a hospital.
With 90% of hotel rooms in Canada suddenly empty, a growing number are being repurposed.
These are not coronavirus patients. These are patients that are in the hospital for other reasons, and they're relocating them to in this case our hotel and other hotels across the country.
This Heritage Hotel in downtown Toronto could be forced to close because of the devastating drop in revenue. Until then, it's offering rooms to nurses.
We reached out to the Nurses Association and to the hospital network to let them know that we are offering a heavily discounted rate just to support them so that they're not having to stay in tents in their garages at home or commute back and forth from work.
A spirit of goodwill is growing, with some hotel franchisees offering rooms for free. The new arrangements are not only for health care. This Halifax hotel is hosting almost 300 Navy sailors. They're being isolated in their rooms for 14 days. Then they'll be at sea on standby for pandemic response. Makeshift arrangements that everyone hopes are strictly short-term. Ross Lord, Global News.
And that is Global National for this Friday. From windy Vancouver, I'm Donna Friesen. We leave you tonight with a big sign of hope from the town of Richibucto, New Brunswick. Lobster traps lifting spirits. Thanks for watching. Robin Gill will be at the anchor